Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Today I would like to briefly discuss Salmonella infection with emphasis on a recent report from the CDC on laboratory-acquired Salmonella infections. Salmonella is a bacteria that was discovered by an American scientist, Dr. Salmon. Salmonella has been known to cause gastrointestinal illness for more than 125 years, and the infection is called salmonellosis. Patients infected with the salmonella organism generally develop diarrhea, fever, and abdominal cramps 12 to 72 hours after infection. The illness generally lasts 4 to 7 days, and most individuals will recover with just supportive treatment. A minority of patients, generally the elderly, infants, and patients with impaired immunity, may have the infection spread to the bloodstream and other body sites. Because salmonella is prevalent in our environment, there are multiple federal agencies with different responsibilities monitoring our food chain for evidence of potential causes of salmonellosis and are responsible for the investigation of origin when infection does occur. CDC works in conjunction with local and state health departments to monitor infections in humans. The Food and Drug Administration inspects imported food, oversees milk pasteurization plants, promotes improved food preparation in restaurants and food processing plants, and regulates the sale of turtles. I find the last item, the regulation of the sale of turtles, most interesting because up until 1972, it was not uncommon for a turtle to be a child's first pet. However, because of the high incidence of salmonella in turtles, the sale of turtles as pets was outlawed. The U.S. Department of Agriculture monitors health food animals such as chicken, cows, pigs. USDA inspects egg pasteurization plants and has responsibility for the quality of slaughtered and processed meat. Through the National Antimicrobial Resistance Monitoring System, all three of these agents are looking for changes in antimicrobial resistance on any salmonella which is isolated. Salmonella is divided into serotypes according to structures on the bacteria's surface. And then the serotypes are used in the investigation of outbreaks of the illness. The CDC estimates that there are approximately 1.2 million cases of salmonellosis every year in the United States, with 450 deaths occurring, these being due to non-typhoidal salmonella. Salmonella serotype typhimurium and Salmonella serotype enteritidis are the most common salmonella serotypes found in the United States. Salmonella serotype typhi causes typhoid fever and is quite uncommon in the United States. Coming to the article at hand, the CDC recently reported that from March 17th to June 22nd, 2017, Salmonella typhimurium infection was contracted in clinical and teaching microbiology laboratories in 16 states by 24 individuals. 6 of these 24 individuals were sick enough to require hospitalization. This is not the first time that transmission of salmonella in the clinical laboratory and in the teaching laboratory has been reported. The most recent reports had been in 2011 and 2014. As with any infectious diseases, there are precautions which must be taken. You should not take personal items into the laboratory that you plan to take home, including pens, notebooks, cell phones, etc. While working in the microbiology laboratory, it's essential to wear personal protective equipment. And the personal protective equipment should not be taken outside the laboratory except for disposal or cleaning. You should not touch your face or other unprotected areas by working in the clinical or teaching laboratory. There should be no food or drink in the laboratory. There should be no application of cosmetics or insertion of contact lenses in the laboratory. And it's essential that after removing your gloves as you're getting ready to leave the laboratory, it's essential that your hands be washed again. This slide is from the CDC Salmonella website, and it has a picture that is suitable for printing off and using in your laboratory to remind people in clinical microbiology to always wash their hands, to avoid contamination. Don't eat, don't drink, don't touch your face, don't touch your mouth. Don't take items into the laboratory that you're going to take home with you. And those items and supplies that are used in the laboratory should remain in the laboratory. And as with any other infectious disease, clean hands count. And it's incumbent upon us to protect ourselves as well as our patients from infection by keeping our hands well washed and using the appropriate personal protective devices.